The number one question patients ask me right after booking foot surgery: when can I walk without help? My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. Over the years, I've learned that the answer depends entirely on what type of procedure you're having. What most people don't realize is that some patients can walk immediately after surgery, while others need weeks or even months before they can walk unassisted. In today's video, I'm going to break down exactly what determines your walking timeline, which procedures allow immediate weight bearing, and what you can expect during your recovery. You'll learn about the different weight bearing restrictions, how to speed up your recovery safely, and most importantly, when you can expect to get back on your feet without crutches or a boot. Before we dive in, please take a moment to hit the like button and subscribe to the channel with the notification bell. This helps others preparing for foot surgery find this crucial information. I post new videos every week with important foot health content. The truth about walking after foot surgery might surprise you, and it depends on several factors that most patients never consider. The type of surgery you're having is the biggest determining factor, but your age, overall health, and how well you follow postoperative instructions all play a crucial role in your recovery timeline. Not all foot surgeries are created equal when it comes to walking restrictions. Some procedures, like removing a small skin lesion or treating a superficial infection, might allow you to walk normally within days. Other procedures, like complex reconstructive surgery or procedures involving bone healing, might require weeks or months of restricted weight bearing. Understanding these differences is crucial for setting a realistic expectation and planning for your recovery. Patients who understand what to expect tend to have better outcomes and fewer complications because they're prepared for the recovery process. Your walking timeline, depending on the type of surgery, comes down to what structures are involved and how much healing time they require. Soft tissue procedures generally heal faster than bone procedures. Procedures that don't disrupt major weight-bearing structures allow early return to walking than those that do. When we operate on bones, we're often cutting, moving, or fusing them together. Bones need time to heal, and this process can't be rushed. Putting weight on a bone that's still healing can disrupt the healing process and lead to complications like a non-union or malunion. Soft tissue procedures, on the other hand, often heal much faster. Removing a neuroma, releasing a tight tendon, or treating soft tissue infections typically allow for much earlier return to weight-bearing activities. Some examples of walking recovery by the procedure will help you understand what to expect. For minimally invasive bunion surgery, many patients can walk in a protective boot within a week. The small incisions and limited bone work allow for faster healing and earlier weight bearing. Plantar fascia release, which involves cutting a tight ligament at the bottom of the foot, often allows partial weight bearing quite quickly. Since we're not working on bones, patients can often walk with support within days of surgery. However, foot surgery with hardware placements such as fracture repair with plates and screws typically require non-weight bearing for several weeks. The bones need time to heal around the hardware, and premature weight bearing can cause the hardware to fail or the bones to heal improperly. Complex reconstructive procedures, like those needed for severe arthritis or major deformities, often require the longest recovery times. These procedures may involve multiple bones, joints, and soft tissue structures, all of which need adequate time to heal. Let's talk about weight-bearing status, which is crucial for your understanding of your restrictions. Surgeons use specific terms to describe how much weight you can put on your operated foot, and understanding these terms help you to follow the instructions properly. Non-weight bearing means you need crutches or a scooter and can't put any weight on the operated foot. This is typically required for 2 to 6 weeks for procedures involving bone healing. During this time, you'll need to use crutches, a knee scooter, or a wheelchair to get around. The non-weight bearing period can be challenging, especially for people who aren't used to assistive devices. Your arms and remaining leg will be doing work they're not accustomed to, and you may tire more easily than usual. Planning your daily activities around these limitations is important for a successful recovery. Partial weight bearing means you can start to transition to put some weight on your foot, but not your full body weight. This often coincides with transitioning to a walking boot and beginning physical therapy. You might still need crutches or a walker for support, but you can begin to put some pressure on your operated foot. The transition to partial weight bearing is often a relief for patients because it marks the beginning of returning to more normal activities. However, it's important not to rush this phase. Putting too much weight can set back your recovery. Full weight bearing means you're back on your feet and can walk without restrictions, though you still may need the support of footwear or orthotics. This is when unassisted walking becomes safe and stable, though you may still experience some discomfort or swelling. What influences your recovery timeline goes beyond the type of surgery you've had. Several factors can speed up or slow down your recovery, and understanding these factors help to optimize your healing. Surgical technique matters significantly in your recovery timeline. Traditional open procedures require longer recovery times than minimally invasive techniques. The amount of soft tissue disruption, the size of incisions, and the complexity of the repair all influence how quickly you can return to walking. Minimally invasive procedures often allow for faster return to weight bearing because there's less trauma to the surrounding tissue. However, not all conditions can be treated with minimally invasive techniques, so the choice of surgical approach depends on your specific problem. Your own healing ability plays a crucial role in recovery timeline. Age affects healing speed, with younger patients generally healing faster than old ones. However, this isn't absolute. I've seen older patients who heal remarkably well and younger patients who have complications. Bone health is particularly important for procedures involving bone work. Conditions like osteoporosis can significantly slow bone healing and may require longer periods of restricted weight bearing. Diabetes can also affect healing, particularly if blood sugar levels aren't well controlled. Circulation problems can slow healing and increase the risk of complications. Good blood flow is essential for delivering nutrients and oxygen to healing tissue. If you have circulation problems, your surgeon may need to modify your recovery plan accordingly. Compliance with postoperative instructions is perhaps the most important factor that you can control. Following weight-bearing restrictions, keeping your foot elevated, taking medications as prescribed, and attending follow-up appointments all contribute to optimal healing. Ignoring restrictions can delay recovery. It's something I see too often in my practice. Patients who put weight on their feet too early, skip follow-up appointments, or don't follow elevation instructions often experience complications that set back the recovery significantly. The importance of elevation, icing, and a boot cannot be overstated. Elevation helps to control swelling, which can impede healing if it becomes excessive. Icing reduces inflammation and pain, making the recovery process more comfortable. Using your protective boot as directed protects the surgical site to ensure proper healing. How to speed up your return to walking involves following proven strategies that support your body's natural healing processes. While you can't rush bone healing, you can create optimal conditions for recovery. Tips to recover smarter, not just faster, include starting physical therapy on time when cleared by your surgeon. Physical therapy helps to restore strength, flexibility, and normal walking patterns. Starting too early can be harmful, but delaying when cleared can slow your overall recovery. Follow weight-bearing instructions carefully is crucial. These restrictions aren't arbitrary. They're based on specific healing requirements of your procedure. Advancing too quickly can cause serious complications that require additional surgery. Using orthotics or supportive footwear when cleared help to protect your foot as you return to normal activities. Custom orthotics can address underlying biomechanical issues that may have contributed to your original problem and to help to prevent future issues. Technologies that help recovery include various modalities that can accelerate healing. Shockwave therapy can stimulate bone and soft tissue healing in appropriate cases. Platelet-rich plasma therapy uses your body's own healing factors to accelerate recovery. These advanced treatments aren't appropriate for every patient or every procedure, but they can be valuable tools in the right circumstance. Your surgeon can advise whether either of these treatments might benefit your specific situation. Red flags of when to call your doctor after the surgery are important to recognize. Signs you're walking too soon include increased pain, swelling that doesn't improve with elevation, and instability when attempting to walk. These symptoms suggest you may be pushing too hard too fast. Signs of complications include infection, symptoms like fever, increased redness and warmth or drainage from the incision site, Numbness or tingling that's getting worse rather than better can indicate nerve problems. Non-healing wounds or wounds that are getting larger rather than smaller need immediate attention. What you should expect at your first post-op visit includes assessment of your healing progress and potential modifications to your restrictions. When walking might be green lighted depends on what your podiatrist checks for during the examination. Your surgeon will assess wound healing, check for signs of infection, may take x-rays to evaluate bone healing. How progress is measured includes both clinical examination and imaging studies when appropriate. Boot to shoe transition typically happens gradually. You may start by wearing regular shoes for short periods while continuing to use your boot for longer activities. This gradual transition helps to ensure your foot can handle the demands of regular footwear. Take the next step by scheduling a consultation to discuss your surgical options if you're dealing with foot problems that might require surgery. During this consultation, we can discuss the specific recovery timeline for your condition and help you plan accordingly. The goal of the consultation is to get a personalized recovery roadmap to take into account your specific procedure, lifestyle, and goals. Understanding what to expect helps you prepare properly and achieve the best possible outcome. If you found this information helpful, please share this video on social media. Your simple share can help someone prepare properly for their foot surgery recovery. Also, leave a comment below if you have a question about foot surgery recovery. I do my best to respond to everyone. I try at least. If you're considering foot surgery and want to understand what your recovery timeline might look like, schedule a consultation for a comprehensive evaluation. We can discuss your specific condition, explain the surgical options, and help to understand exactly what to expect during the recovery. The link to schedule this appointment is in the description below. Thanks so much for watching, and have a great day.